What is Medicare supplemental insurance? Or in other words, Medigap. Medigap helps fill in the financial gaps where Medicare leaves off. In most cases, Medicare pays about 80% of your medical expenses, leaving the other 20% to pay out of pocket. A Medigap plan focuses on those out-of-pocket expenses such as co-payments, co-insurance, and deductibles of Medicare Part A and Part B. Medicare has several parts for coverage: Part A, Part B, Part C, and Part D, as well as the Medigap plans. Once an individual turns 65, they may qualify for certain Medicare benefits and services. Medicare Part A covers against catastrophic events, inpatient care in hospitals, short-term skilled nursing facilities, hospice, and home health care. Medicare Part B helps cover the expense of doctors and other health care provider services, hospital outpatient care, medical equipment, and home health care. Also, many preventative services to help maintain your health and keep certain illnesses from getting worse. Medigap insurance can start as soon as Medicare Part B coverage is in place, but an individual should not start Part B coverage until they are no longer covered by a credible health insurance plan. Let me give you an example. Let's say that Betty is turning 65 years old, but she is planning on working until she is age 67, and she has a company health insurance plan. Betty will need to sign up for Medicare Part A with the Social Security Department, but she should suspend her Medicare Part B until she is about to retire 2 years later. If Betty decides she is going to go ahead and retire at the age of 65, then she should sign up for both Part A and Part B at the same time. Now let's say Betty has her Medicare Part A and B and learns she needs a knee replaced. She finds out that an average knee replacement, hip replacement, or heart attack can cost a person around $40,000. Without the Medigap coverage, she would have to come up with $8,000 or more to pay her 20%. But Betty was wise and purchased Medigap insurance to cover those out-of-pocket expenses. After Betty's surgery, she was in lots of pain and needed to have prescription pain pills. This is where Part D comes in. Medicare Part D helps with the cost of prescription drugs. It can help lower and/or cover your drug prescription cost. Let's not forget Medicare Part C. Part C, or Medicare Advantage health plans, are ran through Medicare-approved private insurance companies. They offer benefits and services covered in Part A, Part B, and usually Part D. Some of these Advantage plans may offer extra benefits for extra cost and may offer maximum coverage with no need for additional supplement. But before selecting a Medicare Advantage plan, be sure to check to see if your doctors and hospitals are in the provider's network. If you would like Medicare supplemental insurance, also known as Medigap, so you can get the maximum coverage and live without network constraints, feel free to contact us. We will show you the plans and premiums for most all companies that are available to choose from with one phone call or visit to our office.